Next, we're going to perform the posterior examination of the chest. Jason, can I examine the posterior aspect of your chest here?
Yes.
All right. First thing that we do, like the anterior aspect, is visualization, looking for any kind of deformities. Upon visualizing the posterior aspect of the chest, we're looking for rib symmetry, scapular symmetry, and midline symmetry. The next thing that we do is examination of excursion with respiration. This is done by holding hands on the posterior aspect of the chest, like this, and having the patient take big, deep breaths. Jason, could you take a big breath for me? Following your hands with the respiration, you look for any asymmetry or decreased movement with this. The next thing that we do is an examination of tactile fremitus on the posterior aspect of the chest. This is done, as we did in the anterior aspect, by placing the heel of the hand between the intercostal spaces. And we start this superiorly and move downwards. Jason, if you could repeat the words 99 for me.
99.
Good.
99. 99. 99. 99. 99. 99. 99.
Again, with tactile fremitus, we're checking for a reverberation at the heel of the hand. Any kind of dullness with this examination would indicate a possible consolidation. The next thing that we do is palpation of the posterior aspect of the chest. This is done placing one finger in the intercostal spaces and tapping with the other finger, comparing tones on both sides. Never palpating over the scapula, as this will give you a dull percussion. A comparison of the tones can also help us assess consolidation of the lung. The last thing that we do is auscultation of the lung. This is done with the stethoscope, comparing both sides. Jason, I'm going to auscultate the posterior aspect of your chest. If you could just take a big breath with your mouth open, and I will cue you. Go ahead, take a big breath now, and out. Good. Big breath. Again with auscultation, avoiding the scapula. Good. All right. This concludes the examination of the